We are at war, a war that is claiming the lives of both the old and the young, a war that is being waged in the streets, in our homes, and inside our public buildings. It's a war that seems endless. Around the world, our societies are in the middle of an epidemic with opioid overdoses. From Tokyo to Texas, the amount of drug overdoses is climbing at an alarming rate. Once thought to be a big city problem has now become an every city problem. According to Kinsman, Edler, and Cantor, in 2014, emergency medical service providers in the United States encountered more than 430,000 patients suspected of drug ingestion. They administered Narcan, a medication that reverses opioids and increases respiratory efforts, more than 150,000 times. This is the equivalent of every person living in Minneapolis, Minnesota, overdosing within 1 year. That includes every man, woman, and child. This epidemic is being fought around the world. In the United Kingdom, according to Manders, there were 3,744 drug poisoning deaths involving both legal and illegal drugs in England and Wales registered in 2016. This is 70% higher than 2015 and the highest number since comparable statistics in 1993. Of these 3,744, 69% were drug misuse deaths. In Australia, the rural areas are being hit harder than the urban. According to Allen, overdose deaths are higher in rural Australia than urban locations. In New South Wales, the accidental overdose rate outside of Sydney has doubled since 2008, from 2.25 to 4.72 per 100,000 people. The deaths are primarily due to prescription opioid misuse. This directly relates to our location in the Appalachian area of the United States. Appalachia is being consumed by this issue at a rate higher than most. Highlighted in the city of Huntington, according to Spencer, the city of Huntington has a distinction of overdose capital of West Virginia, which is the state with the worst overdose rate in the United States. Since January 1st, at least 520 Huntington residents have overdosed, and 34 have died. 2/3 of the deaths are attributed to heroin. The rate is 13 times the national average. This war is being fought by families, medical professionals, and the patients who begin this addiction simply looking for a high and soon find their lives spiraling out of control. The issue is not going away. It is going to take an all-out effort to address this issue, all-out effort of families, medical professionals, mental health professionals, and motivated law enforcement to develop an attack plan that yields results. It starts with education. This education begins in our schools, in our churches, and continues to healthcare workers left to treat the emergent calls for help. As a society, we need to support this mission by understanding it could happen to us, in our families, in our homes, in our neighborhoods. It begins with something as simple as being a friend. If each of us were truly to care about the people around us, we can make an impact with unending support and compassion when our loved ones are first exposed to this crisis. We should not turn a blind eye. Admit that we have a problem and begin the education early and often to stop the next generation from suffering the same results. As healthcare professionals, it is our duty to spread the message of awareness and educate everyone on the warning signs of opioid use and seek substitutional treatments that do not include opioid prescriptions. It could happen to you, it could happen to me, but most of all, it is happening to us.